So when psychologists are starting to use routine outcome monitoring in their practice and using the neuropsychiatrist, lots of psychologists ask us about how they integrate that into their clinical practice. And so what I wanted to show you today is two different ways of doing it. Firstly, the way I do it, and then secondly, the way Nathan does it, so that you get a little bit of a sense about some options about how you might introduce routine outcome monitoring into practice. So for this first example, I am the psychologist, and Nathan, you're happy to be the client?
Happy, yeah.
Great, all right. So in this example, let's say that I've spoken with them for maybe half an hour into the first session, and I'm introducing the idea of measuring outcomes. So Nathan, it sounds like you've been having a really difficult time lately. What I'd like to do is I'd like to give you a questionnaire that allows us to quantify where you're at and allows us to get a bit of an objective measure to see how you're going at the moment. And this questionnaire is called the Depression, Anxiety, Stress Scale, and it's on the iPad, and it'll take a couple of minutes to fill out. Is that all right?
Yeah, that's fine.
Cool. Here you go.
Thank you. All right.
Okay, thank you. Are there any questions that stood out to you?
No, that made sense to me. That was okay.
Okay, so this is measuring depression, anxiety, and stress, and what it's showing is that it gives you a score between 0 and 100. It's essentially a percentile rank that shows where anything above about the 90th percentile shows that you're really struggling. And so on depression, it shows that you scored 95. On anxiety, 90, and on stress, about 80. Does that correspond with how your experience of things is at the moment?
Yeah.
Like depression's the most for you?
Yeah, I can't get out of bed. I'm just constantly tired and low and just crying at a drop of a hat. Yeah.
So what I'm going to do is, during our therapy, I'm probably going to give this questionnaire to you most sessions, just to get a little bit of a gauge on whether you're feeling better, whether you're feeling worse. And the reason why I like to do this is because you won't be very good at remembering how you were today in, say, 6 weeks' time. And the hope is that little by little we'll see some changes in this, and this will produce a graph that can show us where you are today compared to where you are in 6 weeks' time, 10 weeks' time.
Yeah, okay, that sounds good.
Cool. All right, so that's how I do it. So, Nathan, I think you do it a little bit different to me.
I do. It was nice hearing your way, though.
Okay.
I'm going to steal some of those things.
All right, so I'm going to be the patient now.
All right. So, thank you, Ben, for coming in today. And, I'm glad that we've been able to talk a bit about confidentiality and generally how my practice works. One of the other things that I do as part of my practice that may be different to other psychologists is that I actually ask clients to fill out a survey or a questionnaire about how they're feeling every session. The reason why I do this is to check if you're getting better from treatment. And importantly, if I get you to fill this out at each session, hopefully we're going to see that distress coming down each way. And if that's happening, we're just going to keep doing what we're doing in treatment, right, until we get you to your goal. But if that's not happening, if the distress is staying the same or even getting worse, we're going to know about it really early. We're not going to sit on our hands. And I'm going to ask you how I might help better. So any change on this is a way for me to know how to help you more. Does that make sense to you?
Yeah, I think so.
Okay, so what I'm going to get you to do today in our first meeting, first off, is to fill in this form. It's called the Depression, Anxiety and Stress Scale, and it's going to give us a really good indicator of where you are now, so that hopefully we can improve things for you moving into the future. All right, thank you, Ben. So the really great thing about this is that it shows us visually what might be happening to you. The main thing that I look at here is that your overall distress. your overall distress here is in quite a high range, in that extremely severe range, which indicates to me that number one, you're in the right place, okay? You're here in treatment, and that's the most important step when you're in this range. The most important next thing that we look at is why. What are the reasons that have brought you here, and what can we do about it? And that's what I want to talk to you about next. And hopefully, as we continue through the course of treatment, we're going to see the graph go down over time. Does that make sense?
Yeah, I think so.
All right. Thanks, Ben.
So well, that was interesting to see how you did it that time. So there's two slightly different ways of introducing the idea of doing routine outcome monitoring. I suppose a few things that we did that was similar was we reviewed the results with them in session, gave them some meaning about the results, so that we're not just collecting data passively, we're feeding it back to them immediately. And then introducing them to the idea that we might do, we'll be doing this in sessions in the future. So that was good. So if you've got any questions for us, do let us know. We'd be interested to hear about how you go introducing routine outcome monitoring to your clients. And we appreciate that there's lots of different ways of doing it. And these are just two of the ways that we've been, two tried and tested ways, I suppose. See ya.